What's up, medxcoach.com community? This is Trevor Wicken coming at you with John Strauch, the warrior, the man, the myth, the legend. Okay, we're working through an activation series for lumbopelvic hip complex dysfunction. Again, if you haven't seen previous videos, what that means is basically low back pain, sciatica, disc problems. I mean, you can even end up with neck or knee problems with lumbopelvic stuff. Okay, so if you've had anything going on low back now or previously, which is pretty much like 90% of the population over the age of 50, you need to be doing this stuff. Okay, so last exercise we worked on for activation really worked on what's called our posterior pelvic tilt. This next one really works on what's called your SI joint or Sacro-Iliac Joint, and that's right back here where those little dimples are in the back. That's where your hip joint comes together and hooks with your sacrum on the back side here. The sacrum is kind of the bottom of your spine. Now with that SI joint, that can get impacted, okay, just by poor mechanics. If your hip is shifted like this, if there's any rotation in your hips, if there's some kind of lateral leaning like this or some rotation up here in your spine that you don't want, that SI joint can get inflamed, it can get compacted, compressed, and just not be happy camper, okay? That's one of the main causes of low back pain and sciatic pain as well, okay? So this is a really good exercise that I learned from National Academy of Sports Medicine, their corrective exercise programming, to kind of open up your SI joint, okay? Super safe. It looks like you're going to be twisting, but John has a pretty bad back, and he's digging this exercise already, okay?
Digging it, baby.
Digging it. So he's going to lie down, and what he's going to do is you can grab a foam roller. Now, if you don't have one of these, I would highly recommend getting one. You can get one at, Sports Authority or Dick's or something like that, okay? Or you can order them online. If you don't have something like this, find a water bottle or something like that that has about a 4 to 6 inch diameter. What he's going to do is he's going to put this way, okay? He's going to slowly roll over to his side, okay? The top leg is going to go on the foam roller. This bottom hand is going to come over, and he's going to just lightly push down into the foam roller, which is going to make it so this piriformis muscle doesn't kick in. Bottom leg's nice and flat and happy. What he's going to do now is take his hand like this, support his neck. Don't pull your head forward, but just kind of support behind your ear. Now he's going to keep his abs in, and what he's going to do is just slowly rotate backwards until he feels like there's a comfortable spot. You good there?
Good.
And he's going to hold that for about 5 seconds. Okay. While he does that, he wants to pull his abs in and lightly push down with that hand through here. So it's going to open up the rib cage, and it's also going to open up that SI, that Sacro-Iliac joint on the back. He's going to come back forward to about here, which will actually give him a nice stretch through the backside of the shoulder. And then he's going to come back again, okay, and make sure you're breathing, okay? So you're just breathing nice and slow and happy this whole time, okay? You don't need to, it's not working out, you're just going nice and slow. If anything, it should almost be like a stretch or a yoga type of breathing. Real deep breath in, real deep breath out to start training that diaphragm to work with your low back, okay? Come back and relax. Okay, so that's an awesome exercise for Sacro-Iliac Joint. John's ready for his photo shoot for SI, yep, Sports Illustrated. And we're going to the beach. So we'll see you later.
Out.